love just about everything about Western Center. I love the mission. I love the passion with which we pursue our goals. I love the people who work here. Everyone, you know, at every level has a fascinating story of who they are and why they're here. And I think together in concert, we do amazing things. We just had our trial setting conference in our case, Kelly versus Kent, which is about Medi-Cal spousal impoverishment rules, which allow married couples and registered domestic partners who have severely disabled spouses, allows them to stay in their home to receive nursing home level services without their partner or spouse becoming impoverished because of the cost of their care. This is based on a rule that was part of the Affordable Care Act that was supposed to go into effect on January 1st, 2014. The Department of Healthcare Services did not implement the rule until we filed this lawsuit against them in July 2017. Our power as public interest attorneys is to humanize the cases that we bring in front of the court. The law matters in making sure that people get the services that they're entitled to. I believe ardently in the healthcare as a human right. I think that California has done incredible things to advance healthcare rights. And we here at Western Center, me at Western Center, I feel it's our job to hold the agencies accountable for making sure they are in fact promoting and protecting the rights of healthcare consumers. Medi-Cal is California's Medicaid program, which is a healthcare safety net program that provides all medically necessary services for people who have low income. Because almost a third of our state is on Medi-Cal, there are just so many problems in getting people onto coverage, staying on coverage, and then getting access to health care. At Western Center, we make sure that the administration of Medi-Cal is done equitably, that it protects the consumers and beneficiaries' rights, that people get actual access to health care, that their due process rights are protected. I wish I had could clone myself and do a lot of different work. Luckily, there are so many amazing partners within Western Center and across the state that are make up, I think, a really amazing team of people who are covering all of those facets. But it's hard for me not to be able to do more. We see things that have to happen in each person's life become really complicated. Applying for Medi-Cal, renewing your Medi-Cal every year, making sure you get the right notices of action. There are, I believe, over 32 district offices just for Medi-Cal in Los Angeles County, and thousands of Medi-Cal workers. So it's a vastly complicated program in this state, and even more so in the County of Los Angeles. I also love working within Western Center to hear what other advocates in different areas are working on. I'm not a housing expert or a access to food expert, but I'm so awed and impressed by my colleagues who are leaders in those fields, who are doing great work to advance the rights of low-income Californians.